To begin, we would like to provide a brief background on NCUI. Our organization is a national nonprofit devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. We represent the 41 Title V UIOs under IHS in the Indian Healthcare Improvement Act. We strive to improve the health of over 70% of the AIAN population that lives in urban areas, supported by quality, accessible healthcare centers. We would like to acknowledge that this webinar is supported in part by Sanofi, but the content of this webinar is the sole discretion of NCUI. So thank you so much. At this time, we would like to share out our evaluation link and QR code. We at NCUI greatly value your feedback across all of our events. So after our event, if you would not mind taking our evaluation so that we can learn and grow. So today, this is our agenda for today. We will be here about the current vaccine landscape for both RSV and flu, and then hear from two UIOs, All Nations Health Center and Native Health, who will share their experiences and best practices with RSV and flu vaccination and immunizations, education, and promotion strategies. Then we will move into the open discussion and question portion of the presentation, where you all will get a chance to add comments or ask any questions that you may have. So at this time, I would like to pass the mic over to Tiffany.
Thank you, Micah. Good afternoon, everyone, or good morning, depending on where you're from. But we wanted to start off with giving a brief overview of influenza or flu, as well as respiratory syncytial virus or RSV, and talking about the current vaccine landscape for those. So just to start, influenza or flu is a contagious respiratory illness that infects the nose, throat, and sometimes lungs. The people that are at increased risk that we really like to pay attention to and provide support to would be adults 65 years and older, children younger than 5 years old, or children younger than 2 are at the highest risk. Pregnant people, people with asthma, people with chronic lung disease, as well as many more. But that's just a brief overview for that. And next slide. So looking at the flu vaccine, it's very important to prevent the flu by getting the flu vaccine every year. The flu vaccine has shown to reduce the flu-related illnesses and risk of serious flu complications. And it is recommended that everyone 6 months and older should get a flu vaccine every flu season. Those aged 6 months to 8 years who are getting the flu shot for the first time will receive it in 2 doses, and that is separated by at least 4 weeks. Now taking a look at respiratory syncytial virus or RSV. So RSV is a virus that affects the lungs. RSV season begins in the fall and peaks in the winter. So RSV is the leading cause of infant hospitalizations in the United States. RSV can be dangerous for infants and some young children. And children at greatest risk for severe illness, from RSV are infants and young children. The younger the age, the greater the risk. And American Indian and Alaska Native children. American Indian and Alaska Native children are 4 to 10 more times likely to experience severe cases. Next slide. So taking a look at RSV immunizations. So for adults, there's a couple. We have the GSK's Arexvy, Moderna's Embrezvia, and Pfizer's Abrysvio. For pregnant persons, there's Pfizer's Abrysvio. And for infants, we have Sanofi's Beyfortus, the nirsevimab. Next slide. And so this image is very helpful in looking at the immunizations that protect against RSV and really breaking it out over adults 16 over, babies, and then taking a look at the nirsevimab versus the Pfizer Abrysvo. So really helpful information there. Next slide. And here we have an image that takes a look at the fall and winter immunization guide. Making sure that we have COVID-19, influenza, and RSV. and all three can be co-administered. So really important information there. Next slide. And so we are very excited to have our RSV and flu vaccine toolkit available. So that includes social media posts, which are general RSV and flu vaccine posts, Native American Heritage Month post, social media graphics, and flyers. And we have the link in the chat for folks to take a look at on our website, where you could also download these pieces to have on your social media or have the flyers, but they are available. And here we'll take a look at some of the social media posts, excuse me. So the first slide here, we have for RSV and some information that you can include with that image. Next slide. And then we also have one for flu and some information that you can include with that post as well. And then we have more images. First one for Native American Heritage Month, which focuses on RSV. And there's two different information that you can include for two posts, I should say. So there's two options there for that one. Next slide. And this last image we have for Native American Heritage Month, which focuses on flu. It also has two different posts or information for posts, I should say, that you could utilize as well. We really want to thank our communications and graphics team for all of the hard work that they put into those images. And now we would like to welcome our speakers for today. So first we have Dr. Cherith Smith, RPH PharmD, is an enrolled member of the Sicangu Oyate Lakota, or Rosebud Sioux tribe, in the Piikani Nation of the Blackfoot Confederacy, born on the Rosebud Reservation in South Dakota. She received her Doctor of Pharmacy degree from in 2007. Dr. Smith is a clinical assistant professor and director of experiential education and pharmacy practice within the College of Health at the University of Montana, dividing her time with All Nations Health Center, a 501c3 nonprofit urban Indian organization, where she has practiced since 2009. Her role as a pharmacist at All Nations Health Center is an honor and privilege, providing community-based and culturally relevant approaches in serving Missoula's urban American Indian Alaska Native community. And next we have Thomas McClure. Thomas is Bitterroot Salish and grew up on the Flathead Indian Reservation. He graduated from the University of Montana, Missoula with a Bachelor of Science degree in Health and Human Performance with a concentration in Community Health and Prevention Sciences. Previously, Thomas worked as a wildland firefighter, paraprofessional for Salish Language Immersion School, and as a student group coordinator for Curry Health Center. And our last presenter for today, we have Dr. Jennifer Veaco, is a board-certified family medicine physician and a lactation consultant at Native Health in Phoenix, Arizona. She has been working at Native Health for nearly 3 years as a National Health Service Corps Scholar. She led her family medicine residency to be acknowledged as a critical healthcare heroes during the COVID pandemic with the Banner organization in Tucson, Arizona in 2021. Her special interests are preventative medicine and integrative medicine. So please welcome our speakers with your favorite emoji in the chat box. And now I would like to pass the presentation over to All Nations Health Center.
Chesanyakuke pesia, yepenchinas lemti quiliath wasket, chiskeli thu into puhpahot. Good afternoon, everyone. I'm very thankful for today. As mentioned, my name is Thomas McClure, and I'm the Director of Health Promotion at All Nations Health Center in Missoula, Montana. The Bitterroot Salish refer to themselves as the flesh of the land or the people. Prior to the 1890s, the Bitterroot Salish people thrived for millennia in Intla'ai, the place of the little bull trout, where fish, bison, ungulates, roots, berries, and medicines were plentiful. And you'll see some of that imagery of Missoula not so long ago. And guess what? We're still here.
Okay, next go ax. Next to Natanago, what's in the skin? Etam ektatsi geksitoko. Ampetu washte. Good afternoon. We'll go ahead and move to the next slide. I'm honored to introduce you to All Nations Health Center, a community-focused health organization rooted in providing care and support to all our relatives, both non-native and native across Montana and beyond. At All Nations Health Center, we are committed to delivering quality patient care that not only meets medical needs, but also respects cultural heritage and the unique health needs of our community. In our outreach programs, we prioritize cultural competency, humility, and understanding with the goal of reducing barriers, especially when it comes to preventative measures like vaccinations. We serve members of all Montana tribes, as well as tribes from all over the United States and non-native community members. This inclusivity is a fundamental aspect of our mission to create a welcoming and supportive environment for our relatives. Next slide, please. Our Indigenous community faces unique health disparities and significant barriers to care. Historical, social, and economic factors have contributed to higher rates of chronic illnesses, limited health care access, and a lack of culturally relevant resources. Next slide, please. All Nations is dedicated to addressing these challenges, prioritizing a strengths-based focus. We work to eliminate barriers by building trust through understanding, promoting health literacy through culturally attuned events and classes, and increasing access to services that respect and honor Indigenous cultural values. Next slide. Through our community-based research, specifically looking at COVID-19 vaccine hesitancy and confidence, our community identified 5 key factors in creating culturally safe spaces that increase the likelihood of vaccine uptake. The first one, know the community we serve. Number 2, disseminate culturally attuned flyers and outreach that speaks to Indigenous individuals. Number 3, advocate for health equity in the community. Number 4, ask the Indigenous community what they need. They are the authority. Number 5, ensure the organization prioritizes respect, empathy, and digestible information. Next slide. And in taking all of that together, this has been the foundation of how we approach vaccine outreach in our community. We know that we must meet our community where they're at in building trust and rapport and responding to what is important to them. We understand that as we disseminate the services and the resources that we have to look at everything we do holistically. How does it connect to our community mentally, spiritually, physically, socially? And it's not us coming up with the answers. We need to ensure that it's our community members who are leading what we are doing. Next slide, please.
Thanks, Cherith. And yeah, we've used this information to build a relationship with our community, and that's fostered in some of these words you'll see here. That graphic is a few of us going to get some pumpkins for a recent fall wellness clinic that we hold annually to really help get people to attend and receive a flu shot, among other services too. We hold these like on a Saturday. That says 10 p.m. That should say 10 a.m. 10 a.m. to 2 p.m. And these are really popular because people can kind of come in on a day that doesn't fall during the average business week and receive a number of services. Let's go to the next slide. And yeah, it's important to know that in the community of Missoula, what you'll see from a bit of our medical data is that a lot of the patients that are coming through are females 35 to 45 and females about 65 to 75 roughly. But we're also home to a large student population. We have a local university and a very large county public school systems. And so it's I would say that population is like ever changing because there are families, coming in for educational or work opportunities or others. And then at times, they're exiting to return to their homes or start careers of their own outside of Missoula. So this is a flyer that we made in the year 2020 to get some flu shots out to college students. All right, let's go to the next slide. Oh yeah, I mean, we've certainly had to get creative in the way we're looking to administer some of these vaccines. Yeah, certainly during the pandemic and really the facilities we're working with, they just weren't properly equipped to do like a mass immunization type of event. So we've held vaccine clinics in our parking lot. We've done like trunk or treat type events. We would attend other community events such as powwows or round dances, other events that might be happening with the local university systems. So it's really a good way for us, for those that can't get through our clinic doors, we can really go meet the community where they're at and give them information on all things immunizations. All right, let's go to the next slide. And yeah, I really like this flyer. This is one of the first ones that was sent to me from Cherith via the Fort Defiance Indian Hospital. Can you remember where that's located again?
Arizona.
In Arizona. And this graphic, is really special to me because it was a way to, I think destigmatize American Indian, Alaska Native folks into getting or receiving information on immunizations in a really creative way. And from there, I think we really started to take off with some of our flyers that were being posted in the clinic or onto our online platforms. And we just want to, once again, thank Fort Defiance for issuing this idea. We had reached out to them asking if we could use this concept and kind of modify it and make it into our own. And because, we've received help from them, we want to make it known to this audience here that if you need help with, exchanging ideas, getting people to attend various programs and events, we have a pretty robust, what I'll call social media communications team. So we're here to help. All right, let's go to the next slide. And I just put this together this morning. These are some metrics from our social media campaign. That might be a little bit hard to read, but this is the timeline that I have access to from our Meta business suite, and it has information on the number of people we've reached, the number of reactions, and the number of shares. I know when Nikui first reached out to us, they said they had stumbled upon our social media sites and they must have liked what they saw. So over time, we've really grown this this platform of ours, and as it may be similar to some of the communities you're working with. A lot of Indians like to spend time on Facebook or Instagram, and sometimes that's one of the ways you can reach them. And when I'm looking at other various Native-owned organizations or health centers, I see that they're really hindered by some of the content that they're creating. Sometimes the graphics are a bit what I'll call boring, or they're not culturally adapted. And so I can really appreciate the toolkit that Nikui's provided, because that's what good graphics look like, and that's what good captions look like. And then you're certainly free to adapt those as well, make them readable and eye-popping for for those online audiences. And then another thing we started to implement with our social media strategy is knowing when to post. I think this is something that maybe not so many folks think about. But yeah, there are strategies involved to potentially maximize the reach of your online content. According to Sprout Social, the highest range, or I'll say the range for the highest activity on social media can range from the hours of 9 a.m. to 4 p.m. And so we've used that, and we have some priority times where we like to post. And usually no more than one time per day to let your post kind of live for a bit. We like to post at 8 a.m., 5:30 p.m., and then noon. And we've also gathered data from the Meta Business Suite that tells us when our followers are online. And yeah, it just gives a time to circulate through people's feeds and gain the most traction, is what I like to call it. And that's just one channel, to connect with your community. As we know, not everyone will have access to it or see all the content you post. And I just want to say, oh yeah, we have a list of other places that we can post. We always have to be informing our staff so they can communicate with the people they're interacting with, and posting in public places. We've also used various forms of broadcasting, such as like radios, TV ads, grocery stores, really just to get that messaging out about programming and events. Oh, absolutely. And thankfully, we're able to create lists for some of the people we serve, and we can make some of those cold calls directly to help recruit them. That's something I noticed, not just here, but in similar work that I've done in the past, making those personable phone calls or texts out to people, hey, are you going to be there? That's something I might do something personally, but from like a professional level, we can let them know what to expect, or let people know that they're due for some of these vaccines or services. All right, you can go to the next slide. Oh yeah, and this is another way to bring people into some of your programming. You can kind of overlap it with some incentives. Sometimes, we've had produce CSA shares come through, and sometimes we'll sneak in a vaccine if the time is appropriate. We also like to harvest a bit of wild game throughout the year and keep those stocked in our freezer. So sometimes while we're having a clinic or a drive-through clinic or a program, we can also offer incentives to people to take home.
And I'll share that a lot of this really boils down to our community, our relatives who have additional social determinants of health, where as they're coming in, we're identifying that they have some additional needs. And so part of what we do is leverage our treaty rights to harvest bison and elk, and then combine that as they're coming in for a flu vaccine, then going the extra mile to find out, are there additional needs that they have, and then ensure that whatever resources we have in the way of, for instance, food security, we're able to add that on as an additional service at the time that they're coming in.
Yeah, really covering a lot of our bases when we have people kind of wrangled for a single event. Yeah, let's check out the next slide.
So here, one of the very important things for many of our relatives is the relationship with our land, the relationship with our medicines across the area, and the wellness there. So part of what we do, in addition to our preventative services that include vaccine, is also providing wellness kits before they get sick, in the way of preparing medicinal teas that are gathered and harvested with the help of our tribal communities in the area. And so here you can see, for instance, one of our youth who is doing a cedar steam. And then we have some of our additional roots and things that we will use in blending our medicinal teas. So thinking about what can we do for our community members before they get sick? How can we make sure that every household has things that represent and are important to them in that holistic wellness, knowing that we as Native people have been pharmacists and physicians with our traditional medicines way before vaccines. Next slide. So before we end, I think one of the most important things in working with our community is establishing trust and relationship. Those connections are incredibly valuable. And sometimes we will head out into the community with no vaccines at all, just us sitting within the community, asking if there's any questions, bringing our providers out into the community in the different cultural gatherings so that the community members get to know them. Early on in working with All Nations Health Center, there were a lot of questions that our community members had. And so just being there, being present to answer questions honestly about vaccines, about what should I expect from a vaccine? Can this vaccine make me sick? Who else is getting the vaccine? Is it safe? Those are the types of questions that will go out into the community and just have table topics. So it might be cultural gatherings, but it might just be sitting there with the community. I thank you so much for inviting us and letting us share with you. Aho, wopila.
All right. Lam Pesia.
6 months. Thank you.
Thank you so much for All Nations Health Center for presenting. I'm Dr. Veaco. I'm a family medicine doctor, and I'm going to be presenting about what Native Health is doing to help vaccinate our communities. So with Native Health, we're a patient-centered medical home. We're in the Phoenix Valley. We have 3 locations. We're a federally qualified health center. And we are an urban Indian organization. We're also accredited by the AAHC, and we're a HRSA site. So this is just a picture of one of our drive-through events, and I'll talk more about that, and let's discuss how we can better protect our communities. So for our mission and vision, our mission of Native Health is to provide accessible, holistic, patient-centered care to empower our community to achieve the highest quality health and well-being. And our vision is healthy people in healthy communities. These are our 3 locations, and we're adding a 4th location next year. So our 3 locations throughout the Phoenix Valley, we have one in the central Phoenix area, one more on the west side of Phoenix, and one in Mesa, which is on the east side of the Phoenix Valley. At Native Health, we provide a variety of services. So we provide primary care, dental, behavioral health. We also provide WIC and wellness programs. So when we think about how can we best vaccinate our community, or at least just provide education to our community so that they can make a decision on if they want to be vaccinated, we really have to think of the flu season as a season itself and gear up and make sequential things, events, notifications to help educate our community and bring them in for vaccinations if they choose to do so. So in the beginning of the flu season, we do send out mailers to our patients. This is usually in early September time, and we use a mailing house, and we send out mailers to the patients who have interacted with Native Health in the past year. And it can be in any of our services, not just medical, but dental, behavioral health, or with our community health and wellness programs. So this is an example of a mailer that was sent out this year in early September, and it talks about 2 of our drive-through events that are upcoming, one in Mesa and one in the Central Phoenix location. They're both on Saturdays in the morning time. In addition to providing drive-through events at our clinics themselves, we also do work with the ASU, the Arizona State University. So we did go to the campuses, 2 campuses for their student groups to help vaccinate students and faculty. And we vaccinated about 30 individuals at our ASU events. In addition to notifying via mailers, we also try to display signage in our clinics that, hey, flu season has arrived and we should start thinking about it, or you can ask your provider to get a flu vaccine that day. So this is an example of the poster that we have in our lobbies. And we also have the same poster in our exam rooms. So for instance, this poster is when patients check into our front desk. They're on all of our front desks saying, hey, we have flu, COVID, and RSV because it is the season. Please talk to your healthcare provider to get this. We have this same poster on the back of our exam room doors. So for instance, when a patient is roomed in the medical clinic and they're waiting to be seen by a nurse or a healthcare provider, they see this poster on the back of the door. And I can attest, when I'm seeing patients in the clinic, they will reference this poster that they're staring at on the door as they're waiting for me, and they will mention, hey, I saw this, you do have flu, or you do have the COVID vaccine, let me hear more about it, or let me get it today. Same thing with them seeing the signage on the front desk. Sometimes when they're brought back for an entirely different type of medical appointment not related to being vaccinated, they'll say, hey, I saw that you have the vaccines, can I be vaccinated today as well? So this is, in addition to our mailer flyers, we also have many social media posts that go out. So we are on, Native Health is on Instagram and Facebook, and we post upcoming to the event and then on the day of the event. So this is an example for one of our drive-through events for flu vaccines at the Native Health Central location. We were offering blue corn mush and wild tea. We also have an open house every year. And what's nice is our community members have come to expect this open house in October time every year because we've made it such a tradition for a number of years. With our open house, it's a lot of fun. It is, we have lots of games, treats. We have other community members kind of giving away various items, whether it be bags of essentials or books, that kind of thing. That's mainly in our parking lot area. And then we have our clinic that our doors are open during that open house time. And so in our clinic area, we do a lot of free health screenings. So this is the back side of our mailer about the open house. And you can see that on the bottom there, it talks about our health fair, and we have dental screenings, flu shots, diabetes screenings, other health tests. So this year we checked blood pressure as well. We did BMI for those who would be interested in checking their height and weight. And we have front desk individuals there ready to schedule appointments. So for instance, if someone comes in, it finds out that their A1C is high for diabetes, or they get the flu vaccine and they want to have other vaccines, or they want to get caught up on their childhood immunizations, they can schedule an appointment with our providers that next week, because this open house is on a Saturday. And all of these health screenings, including the vaccinations, are in our lobby right when they walk into the doors of our clinic, which is really nice. They don't have to be wandering through the halls trying to find where they need to go. It's just right there. So these are some pictures of our open house this year. You can see that we had signage on our windows there. We had a stand-up sign kind of ushering people into our clinic, because there's a lot of activity happening in our parking area, a lot of fun things going on, and we try to usher in people in our clinic if they're wanting to participate in our health screenings. And you can see we have a picture of one of our community members getting vaccinated. So these are some pictures of our drive-through events, and we found that our drive-through events are also very successful in vaccinating a large number of people. So to go back to our open house, we vaccinated over 80 people in a span of a few hours. Now for our drive-through events are also 2 hours each, and we vaccinated 65 people at our Mesa clinic and 55 people over at our Central clinic. We love drive-through events because they're a lot easier to kind of load up all your family, your kids, get your kids buckled into their car seats and stay in the car. And that way we can bring the services to them. It can be difficult, especially if you're wanting to vaccinate children, asking people to park, to take their children out of the car, to make their way inside the clinic, and to do all those steps. So we've tried to really reduce barriers and have a convenient way for people to come in and get vaccinated, to come through the drive-through. With our vaccination events, we just have one sheet of paperwork that they need to fill out. So we've also reduced the paperwork that they need to go through and sign dramatically so that we can really run this drive-through event most efficiently. During our drive-through events, we also post a number of social media videos, live streams and videos saying, hey, come out, this is what's happening. So there's an example of a video that we had posted about our tea is simmering and the blue corn mush is ready to go. Please come out for your flu vaccine. And we found that videos get a lot of traction on our social media site, a lot of interaction. You can see that when we took a screenshot of this video a few weeks ago when we were making this PowerPoint, already there was 2.4 thousand plays for this particular video about the tea. Here's some more pictures of our Native Health Mesa drive-through event, and you can see how convenient it is for people to kind of go through the line there. And we have a kid there just taken out of their car seat, mom's holding little shot in the leg, and then right back into the car seat. All right, okay, let's go. Let's have the rest of the day to ourselves. We found that Saturdays for these vaccine events are the most helpful, or I guess we get a lot of people coming out for those compared to in the past. We've also had drive-through events after hours on weekdays, so like from 5 to 7 p.m. And we don't get as many people going through those drive-through events. And I can only imagine it's like you've had a whole day of work or a whole day of taking care of your children. And do you really want to bring everyone to the clinic to go through this drive-through at the end of the day when everyone's hungry during dinner time? I mean, probably not. So the Saturdays work well for us. We've also noticed that we've tried various times of these Saturday drive-through events, and there is such a thing as too early. So when we do the drive-through event from 8 to 10, we don't get a lot of people coming in around 8. It's a little bit too early, especially for a Saturday sometimes for our community members. And so the sweet spot we found is more like 9 to 11 or 10 to noon for these Saturday drive-through events. Here are some pictures of our Native Health Central drive-through event. Very similar setup to the Mesa drive-through event. And once again, we did have some videos on our Instagram and Facebook to try to entice people for coming out. We also have a lot of information about Native Health, various flyers about the services we offer. Of course, like fun little freebies that we give out. So we had like a 2025 calendar we were giving out. Also in October time, we were trying to encourage people to be registered to vote. So we had some beautiful posters that were designed by community members about voting, and we were giving those out as well. We also had a drive-through event over in Guadalupe, and so we're working with the Pasco Yaqui tribe, And this is actually going to be one of our locations that we're opening next year with Native Health in the Guadalupe area of Phoenix. And we had some sweetbreads as options for people to come out if they wanted to have a sweetbread through the drive-through event. When we talk about flu season as a season and really trying to educate our community to make the decision on if they want to come in or go to one of our events for the vaccinations. In addition to doing lots of mailers and advertising on social media and sending things through the mail, we also have our Native Talk Arizona. So Native Talk Arizona is on FM radio. It's also podcast available on all the main places, whether it be like Google, iTunes, Spotify. And so in October, we did some information, kind of like a Q&A about common questions about vaccinations, and people could kind of tune in and listen to that for further education. So this was actually recorded in September, and then we posted it on Native Talk Arizona October 9th. This year particularly, we talked a lot more about the RSV vaccine because it is like newer. And so we kind of debunked some myths about RSV, and we talked about how prevalent it is in our community and how, you know, those who are eligible for the vaccine should definitely consider it. So for our social media and Instagram, we do have a large following. For Facebook, we have 30,000 plus subscribers. And then also for Instagram, we have over 7,000. And this is my contact information. If you have any additional questions, please reach out. Thank you for having me.
Thank you so much, Cherith, Thomas, and Dr. Veaco for sharing. Amazing work being done in the communities in which you serve. So thank you so much for sharing that with us. So now we will move into our open discussion portion of the event, where the floor is open for folks to ask any questions for the presenters on what they presented, or if anything else has come to mind. Now is your time.
I put mine in the chat, but I was just curious if you get the permission for the photos or the videos at the drive-through clinics as part of your one-page form that you have to get permission to have the flu shot.
So we don't particularly ask in regards to our one-page flu vaccine fill out form. It's part of, if someone is a patient of ours, they have filled that out as part of their new patient packet. And we're just conscious about what we share on social media. A lot of the images I showed were, staff members that felt comfortable sharing, in addition to being either on social media or to being part of this presentation. So a lot of our pictures are, staff members, family members, children, that kind of thing, which makes it fun.
Yeah, I think that's great. Always, checking in each step of the way to make sure what you're posting is being used with permission. Yeah, we do have a separate media release. At one point, it was in our registration packets, and I think we've had shortened versions to get it onto one-page forms, but our general media release form it's just a one-pager.
It's very simple, and we have a number of our community members, our relatives, who are okay with sharing their photo in certain photo opportunities that we've had, and then others they decline. So we do it every single time that we take a photo.
I'll check
I had a
the chat
question.
to see. Oh, go ahead.
Yes, this is Adam from TIC in Tucson. For your drive-through events, are you also finding that there's a lot of people that are not registered with your organization that they need to register that same day as, you know, they're doing the drive up?
So we don't require someone to be a patient of ours to participate in our drive-through events. What happens is when they fill out the one-page consent form, and if they're not part of our system, we just add them as someone who has interacted with our with Native Health. So we don't make them fill out the complete new patient packet at that time.
For our organization, for our drive-throughs, we do need them to be fully registered with us. And so we are a very tiny center, and we're located on a corner of a lot. And so we have a designated parking area where we have people who are brand new fill out the registration paperwork.
Gotcha. Thank you. I think our organization, if we were to ever host an event like that, we would probably follow into the same boat as All Nations.
All I can share is that that has not been a barrier to those individuals who have wanted to do the drive-through and who are not registered with us, just as long as you have that parking lot designated area. And then we use our health promotion team to run the clipboards back to the team once everything is filled out. And that includes scanning any tribal IDs, insurance cards, things like that. We have runners to do that.
Yeah, thankfully, Cherith has a pretty solid system down, so that that's where people like myself, like she was mentioning, can handle some of that paperwork, or that's where incentives I think come into hand for those type of events, as to reduce the barrier, I guess, because as we all know, like paperwork's not fun for anyone, and we've made a lot of efforts to improve our registration form, and I'll say it's ongoing, if that is a barrier for some of you all.
Just checking the chat. Doesn't seem like there's anything in there yet. But I did have a question. It was meant to be a polling question, but technology likes to work when it wants to. But to see which RSV vaccine / immunization does your UIO offer? So if it's all of them, or if we have GSK's, Arexvy, Moderna's, and Mrezvia, Pfizer's, Abrivzeville, sorry, Sanofi's Beyfortus, Nirsevimab, or none at all.
So with Native Health, we do have Beyfortus for the little ones, and then we have the Pfizer vaccine for our elders and pregnant people. So we do offer that. It's definitely a topic of education because it is newer. What I found has been helpful just as a provider is I do really enjoy the CDC information sheet about RSV. It's like on the CDC website, you're in the RSV information. It's like a one-page PDF, and it talks about how our community members are at greater risk for serious infection. And I think that's helpful for education. And then also talking about what RSV is. And sometimes when I explain RSV, the patient will be like, oh yeah, my son had it when he was 3 and he needed to go to the emergency department. And I'm like talking about I have a point with their 4-month-old now. I'm like, oh, so it sounds like your son, was exposed to this and it was pretty serious. Now that we have this vaccine, like, do you want to use it for your newborn? And oftentimes it's yes. It's just, you just need to take the extra time to educate what the vaccine is for.
Awesome. Thank you so much. Just checking the chat, there was a couple things in there. The pediatric RSV, tried to access adult RSV through National Service Supply Center, but they had limited supply. They were unable to provide us with immunizations at that time. And then Allison shared the RSV vaccine information statement from CDC.
I have one more question.
Yeah.
So for artwork, for social media posts, or for flyers, who do you recommend to work with? Do we reach directly out to the community or to the health center?
Yeah, I would say for us, it depends on the type of event. Yeah, there's so many talented folks in our community that one or more of us are likely connected with. So if there's an opportunity and we can and we can pay them, we'll sometimes go with that route. Otherwise, we'll look at yeah, some folks on staff that can provide that artwork.
And I'm just going to expand this just a little bit because this is the most critical component, and that is the messaging really has to come from within the community. So our staff, we are well integrated into the community at the table, listening and hearing what type of messaging and how the messaging is being received, but also any comments, feedback, and then we bring that back to the table. We are blessed with a number of very talented individuals in-house. One thing that I will share, however, and this may be food for thought, we have had individuals who come from specific backgrounds in graphic design, in health literacy, who have developed things for us that have not been as well received as some of the more grassroots flyers and social media postings that have come from within. So it's important for us to really understand what works for our community rather than what does the literature say we should be using.
Yeah, I like Cherith's comments about the feedback that comes through to staff, you know, post event. Because yeah, we definitely hear it, and we have to take in what they say and make improvements or change up things as needed. Yeah, I'll say, and a few of us are sort of self-taught, I guess. We're big fans of grandfather Google and getting some ideas sprouted at least, and then we'll use basic platforms to create some of that. That's either like Adobe Illustrator or Canva.
And if you have specific geographical lingo or tribal lingo, they definitely appreciate it when we're inserting language and also the local slang into our messaging.
Yeah. And that's definitely regional. I know, yeah, Missoula's, we do have an urban Indian organization here at All Nations Health Center, but we're pretty confident that there's well over 50 tribes in our community. Yeah, a few years ago, local school data told us there was 80, but that was just in the school system. So we're getting people from all over the lower 48 and beyond. So there's different styles, flavors of art, and we do our best to try to touch on the ones at least in Montana, but yeah, we can reach out beyond too if it's warranted.
Regrets, thank you.
Alrighty, we could advance to the next slide. Thank you, everyone. So we do have our resources included, and just a reminder, this PowerPoint and the recording will be made available following the meeting, so that more to come with that. Next slide. And we did want to share our investing in wellness financing strategies for behavioral health in Indian country. So we do have that for you. You can use the QR code now, and it also will be coming in the email, the thank you email that we'll be sending. Next slide. And we do have a reminder for the evaluation QR code, and the link is also in the chat. Definitely let us know how we did. We would love to improve for you in the future and also learn about what you would like to see in the future as well. Next slide. Upcoming NACUI events, we have another event on the 14th, managing healthcare operations, leveraging tax incentives, loans, and grants from the Inflation Reduction Act. That's at 2:30 to 3:30 p.m. Eastern Time. Next slide. And we also have the save the date for our annual conference. So April 22nd will be the board training for UIOs only. April 23rd to the 24th will be the conference. And April 25th will be Hill Day for UIOs only. Next slide. And we also have our one-on-one technical assistance available. So feel free to send us a request and we're happy to help assist you with any support that you may need. Next slide. And again, thank you all so much for your time. Thank you again to our amazing speakers, Cherith, Thomas, and Dr. Veaco. We at NACUI appreciate everyone volunteering their time, but also their thoughts, experiences, and suggestions. Any final questions, comments, please feel free to put it in the chat box. We'll hang around to collect those. But again, thank you so much and have a wonderful afternoon.